Good afternoon. Despite advances in care, people on dialysis still face high mortality rates, and suboptimal care during the pre-dialysis period may be a possible contributing factor. As we know that earlier specialized nephrology care is associated with significant better outcomes. As anemia and CKD-MBD are modifiable risk factors for cardiovascular and kidney disease progression, we need to emphasize in the early recognition and treatment of these conditions. And we conducted this study with the aim to identify factors that could predict CKD-related medications. So medications like vitamin D receptor activators, phosphate binders, ESAs, erythropoietin-stimulating agents, and iron. For this purpose, we use the HARO3 cohort, which is a retrospective cohort of pre-hemodialysis patients enrolled in Fresenius medical centers. Inclusion criteria were pre-hemodialysis patients with CKD stage 4 or 5, older than 18 years old, and at least with 90 days of follow-up. This cohort recruited in total 2,471 patients, and of them, 2,196 were included in the present analysis, as patients which were transplanted in the pre-dialysis period, or patients with less than 90 days of follow-up in the pre-dialysis period, or patients who required acute dialysis in the pre-dialysis period were excluded from this analysis. Then we divided our cohort in derivation and validation cohort, and we performed binary logistic regression. Here you can see the table with the baseline characteristics of the entire cohort, the derivation and the validation cohort. The mean age of the patients were 69 years old, with 52% of them being women. Diabetic and hypertensive nephropathy were the most common causes of CKD, and eGFR at baseline was approximately 90 ml per minute. Here you cannot see very good because it's a very long table, but all three cohorts, so the derivation, validation, but also the whole cohort didn't differ significantly in any of these baseline characteristics. Following backward selection, we found that significant predictors for the prediction of erythropoietin-stimulating agents, you can see here in this part of the table, were vitamin D receptor activators treatment already at referral, iron treatment already at referral, low hemoglobin levels below 160 grams per liter, elevated intact parathormone levels above 150 nanograms per liter. Regarding iron therapy, predictors were lower eGFR at baseline and treatment with erythropoietin-stimulating agents already at referral. Predictors for phosphate binders were younger age and elevated intact parathormone levels above 150 at baseline, low hemoglobin levels, serum albumin above 35, and eGFR. And then risk for requiring vitamin D receptor activators was history of diabetes, again, abnormal calcium levels, elevated parathormone levels above 150, and serum albumin levels above 35. On the right table, you can see the performance of the different models, and as you can see, we have a varying performance with ESAs and phosphate binders demonstrating the better performance with area under the care of 0.73, 0.74, or 0.772 in both cohorts. So the present study investigating risk factors for CKD-related medication in a cohort of CKD4 patients, age, history of diabetes, intact parathormone, hemoglobin, calcium, and serum albumin levels, predicted medication needs. And we found that 60% of patients were predicted to have a likelihood of receiving of any of these medication of less than 20%. Thus, by identifying low-risk patients who may require less frequent follow-up, this study has the potential to optimize the use of healthcare resources and enhance patient care.